So this is my head to toe assessment. My name's Grant Partin. As I walk into the room, I'm going to wash my hands first of all. When I introduce myself, my name's Grant Partin. I'm going to be your nurse today, do your assessment. Make sure all my equipment's clean also. Want to go ahead and check her, make sure she's alert and oriented to person, place, and time. Just get her to ask her to state her name.
Sandy Webb.
And where you're at, of course, and of course the time of the year, or maybe who the president is, and that should determine that you're alert and oriented time 3. Of course you are. When I also come into the room, looking at her, I want to do an inspection right off. General appearance, first of all, what she looks like. Skin is pink, looks dry, so, and then we'll just go into the assessment. And so after I introduce myself, we're just going to start at your head here, and we're just going to work our way down. So, first of all, we're going to check your lymph nodes, and I'm going to start behind the ear, work around. We'll do the head, neck, and then as we come down, we'll check your lymph nodes also, your axillary lymph nodes. So, I'm going to use my 3 middle fingers to check. We'll start back here at the base of the skull. If you kind of look down, we're going to feel here. Just note any tenderness. Just let me know if there's any tenderness. Lymph nodes do not feel enlarged. Work your way just around to the front of the ear here. Gently palpating. Let me know if you feel any tenderness. And we'll check these lymph nodes just above your clavicles here also. Any tenderness?
No.
So, lymph nodes does not look enlarged. Also, while I was feeling, I can also feel her skin. It's warm and dry. I want to feel that with the back of my hand. We'll check your pupils now also. I want you to look straight ahead. Just focus on that picture there on the wall. I'm just gonna hold your eye open just a little bit so I can see a little bit better. We do have some constriction there. Can you just focus on my finger there? So pupils are equal, round, reactive to light and accommodation. Okay. I'm also going to look at your mouth. So if you open your mouth for me, just say ah.
Ah.
Mucous membranes are pink. I don't see any lesions or anything. Keep hold your lip down a bit and we'll look there. Alright. So good and pink, moist. And next, I'm going to move down to your chest. We'll listen to your lungs. Start anterior, we'll also listen posterior. So if you just sit up really well, okay. That's good right there. Oops. Let's take a deep breath for me. There you go. We'll listen to your side here and also to your back. So lung sounds are clear bilaterally. Also, we can do if you want to lay back, you can do this. Watch for the thumbs to take a deep breath for me. We're going to watch for those thumbs to separate. Of course, you would be in a hospital gown. She wouldn't have his clothes on, so you would see those thumbs separate. Also do that to the posterior side also. We'll do that once we get up here in a second. Once we have you stand, we'll check that also then. Also, you can pinch up here, go above the clavicle here. We're going to pinch up some skin, looking for the skin turgor, see if we note any tanning. Of course we don't. Do both sides. Just pinch the skin up. So, good skin turgor. Also, I'm going to go ahead, we'll listen to your heart also. I'm going to listen to a Z pattern starting to the right of the sternum, second intercostal space. We'll move over to the left, the sternum also. I'm going to move down each intercostal space and listen. And I'm going to go to the fifth mid-intercostal space and listen for a full minute to the apical pulse. All right. That was a full minute, so which was regular rate S1, S2. I didn't hear any S3, no S4, no murmur, and it was about 82 beats a minute. So, also while I'm doing this, I'm also going to inspect the skin here. Also, looking to note any lesions, anything abnormal there. And at this time, I'm also going to come down. I'm going to check your radial pulse also. And I just want to note that it's regular also, and actually about a 2 plus there, 3 plus, so about 3 plus. We'll do both sides. We want to compare both sides also. And that one's 3 plus also. That one seems a little bit weaker than that one. I think that may be because of that scar where you've had surgery on your wrist there. Also, I want to note the temperature of the skin here. It's warm, it's dry. Inspect that skin also. I don't note any. It looks normal. No lesions or anything. Nothing abnormal there. Next, I'm going to move on to the abdomen. We would also check, we could check her fingers here. Of course, she has on red fingernail polish, so we really can't press and there. But anyway, to check the cap refill. Also, I could just push her hand there and just watch for the color to return there. So, and it is less than 3 seconds. So we do your abdomen next. I want to inspect the skin there also, noting any lesions. I don't see anything. Everything looks normal. Skin's pink, warm, and dry. First of all, I'm going to listen for bowel sounds. We'll listen to all 4 quadrants. We'll start in the lower quadrant here. So bowel sounds are normal. Whack it. Hit you with my stethoscope there. Also want to palpate the abdomen. Also, let's do some light palpation. Note any tenderness, any masses. Start down here in this lower quadrant. Just work our way around. Any tenderness there? No. No tenderness noted. Don't feel any masses, anything abnormal. I think I already talked about the color of the skin there. We did both arms, the color of the skin there. We'll also go ahead and check your lymph nodes, your axillary lymph nodes. So I do want to have you sit up for that. Now what I'm gonna do is I'm gonna hold this arm, just kind of hold it up here, and I'm gonna start under here. Just gonna start right in the middle first here, just kind of those 3 middle fingers there. Real gently kind of palpate there just to feel those lymph nodes. And I'm going to do also to the side of each axillary area there. Noting any tenderness, Also just going to go down the arm here. Any tenderness. So that part of the assessment is normal also. Would do both arms. It's kind of difficult to get over there and do that arm, but we'll do this arm. Just going to support her arm here. We're going to start in the middle here. Any tenderness there? Side to the So that part of the assessment is normal also. I'm going to move down, check your legs. So I'm going to inspect the legs also. Of course, you've been in a hospital gown. We're going to look at skin color. Skin's warm, dry. Also, we would inspect for any kind of lesion, anything in that nature. Everything's normal. So we can check for edema down here in the ankles. I don't see any edema in the ankles. Alright, we're also going to check, of course her toenails are painted, so we can't check our cap refill there, but we would normally check that. Be less than 3 seconds. We can also push on the skin here, kind of note the refill, what we get there. Check the DP pulse, dorsalis pedis, both feet. Alright, a good 3+. Check the PT. Strong. 3+. We'll check both sides, compare them. They feel regular. Alright, so that part of the assessment is normal. I'll go ahead and get you to squeeze my hands. I'm just going to check your grips there. Alright, good grips. 5 out of 5. Also, if you can push down with your feet. Alright, good. Like 5 out of 5 there also. So I think that's pretty much head to toe. On your abdomen, the thing I didn't check also that we would normally check was we could take a light and also probably have you lay back flatter. We're going to shine that light across, looking at the contour. I'm going to stoop, get down and look. We're also going to note any masses or anything. And that part of the assessment looks normal. So, alright, so if you want to, I'll go ahead and get you to stand up over here. Alright, just turn around that way. We are going to take a look at your back, and I said earlier we could do this here to have you take a deep breath. Just looking for bilateral rise and fall. We're going to see those thumbs separate. Of course, we wouldn't have a shirt on, but that is normal. So she does have equal rise and fall. We're going to look at her back. We're going to inspect the back here, look for any abnormalities, look at the skin. Always looking at the skin over the entire body during the whole assessment to see if there's any lesions, anything abnormal there. So nothing abnormal. I'm going to go ahead and have you bend over, and I'm just going to look at the, of course you wouldn't have a shirt over on. We're just going to stand back and we'll get out of the view of the camera here, but we're going to look at the back, make sure everything is straight as far as the process of the spine, and go ahead and stand back up. So everything looks normal, no scoliosis or any abnormal curvature there. Also, we can do the muscular of this muscular, can't think of what I'm trying to say here, vertebral musculature. I think I'm using the correct language, but So, which would be the muscles attached to the spine down through here. We're going to note any soreness or any tenderness on the back altogether. But I'm also going to just kind of press down through here, just note any tenderness. No. Okay. All right. So your assessment was normal. I didn't note any abnormalities. Um, I guess we didn't take a look at your ears. Almost forgot your ears, so we should probably let's take a look at your ears. If you can go ahead and sit back down, we'll do that. Any problems with your ears?
No.
No. Okay. So, and I don't have an otoscope, so but I do want to come back. Also, we just want to note the outer aspect of the ear. We're going to note any lesions there. Just inspect it also. Going to take upper part of the ear here. We're going to pull it up. Insert the otoscope looking toward the nose. So, and really, I don't have the otoscope, so it's almost impossible, but I just want to be able to describe how you do it. Looking toward the nose. So, generally, we want to insert in there. Looking at the membrane, we're going to note any redness there, any drainage. We're going to see that gray tympanic membrane. And we're going to look at both sides. We're going to go back over here and do this side also. Doing the same thing. We're going to lift this ear up. Insert the otoscope up toward the nose gently. Noting all the same things we talked about here on the other side. We looked in the mouth earlier. There's no drainage there, no exudate, nothing abnormal there. I think we covered everything. We did the skin, the warm, dry, both legs. I think that's it. That completes my assessment, head to toe assessment. Thank you.